Yeah.
Welcome to December, everybody.
hmm
From the B School, Be Better, Be Empowered. I
hmm
am Dr. Emery Pitcel, chiropractor of Rothrock
hmm
Chiropractic and Rehabilitation.
Yep. And I'm Ben Ciccarone with Wellness Wave Massage. Yeah. So we are finally in. Kind of feels like the full swing into the holiday season right now. It's December,
Yes,
and
yes.
it is a time when massage could be very enjoyable. You
I would
know.
say so.
Yes.
Yeah.
Something to keep you nice and cozy.
Well, especially too, since you've got the nice
hmm
heated
hmm
massage bed and
hmm
everything, so you get that nice toasty
hmm
warm to chase some of the
hmm
winter cool away.
Yep.
And we know, unfortunately, too,
hmm
the cold kind of likes to make the arthritic joints flare up a little bit. So making
hmm
sure you're moving as optimally as you can. And
hmm
with our good kind of decompressing stretches therapy and home empowerment,
hmm
the Cairo side of things is not a half bad
hmm
idea in December either.
hmm Yeah.
Um, not everybody could probably
hmm
see this, but the day that we are recording
hmm
this podcast, it is snowing outside. So just
hmm
further vindication that it is
hmm
indeed December of
hmm
2024, right?
Yes, that's right.
Yeah.
Yeah, and speaking of snow and lumbar erectors, they may go hand in hand with shoveling snow
It's
and
almost as if we picked this podcast on
uh,
purpose, dude. But in all likelihood, it's probably a
hmm
coincidence. It has to be,
hmm
right, Ben?
yeah, probably, I would
Yeah.
say.
But like you said, this
hmm
is our fifth podcast series for the month of December.
hmm
We're going into the lumbar erectors, which, of course, for those that don't know, it's basically the anatomical and medical specific way of saying your low back. So we're
hmm
talking about all the muscles right there in the lumbar region, your low
hmm
back from the bottom of the ribs, basically to the very tippy top of the pelvis. There,
hmm
correct?
Yep.
And how common do you find issues in the lumbar erector muscles then, Ben?
Well, I find usually um, sometimes more issues than people realize
Mm-hmm.
because I I would how if we're talking about how common it is, I mean I probably around probably 80% or so. I would say. Um, I mean, but usually people come in initially for some type of issue with the neck and shoulders. That would probably be um, the most that I would see initially with that, and then they become more aware as the massage progresses of issues in the lumbar region. And that's not to say that there are people that come in specifically just for low back
Mm-hmm.
issues, but if we're going, for the commonality thing, um, it it's it's not the most common, but it's definitely way up there.
Yeah, that's fascinating
hmm
that you say that, and I love the way that you walked through that. That you say
hmm
probably maybe the most common that would come to you and say, "Hey, I think I need massage," as they're picking up. It's in their shoulder blades.
hmm
So this is kind of precisely in the chiropractic wheelhouse. I love
hmm
that you said 80% is what you feel like you work about. 80% of low back work. A lot of the literature and uh, papers that are out there for physical medicine for chiropractors and for physical therapists and whatnot,
hmm
they'll actually commonly cite the statistic that 4 out of 5 Americans get at least one severe episode of low back pain at some point in their adult life.
hmm
So I'm not much of a math whiz, but I'm pretty sure 4 out of 5 is
hmm
80%. So it's funny that we're both kind of sitting here and saying 80%.
hmm
This is our most common thing that comes to chiropractors.
hmm
I usually kind of, I've said in other videos, and I'll continue to maintain, if you probably polled most people and you said, hey, what is the one area that a chiropractor treats the best? They
hmm
would probably tell you the low back. So this is definitely our most common.
hmm
Sounds like it's high up on your list too, just maybe not the
hmm
initial thing that some people come into
hmm
until they start to kind of get a little bit more of that mind body connection and realize
hmm
there is actually a little more going on there than they
hmm
realized, right?
Yeah, for sure.
Yeah.
So I mean, so you definitely see a lot of patients with low back issues. So what do you think would be, you know, what's
Yeah.
causing them to have those
Y-
those issues or pain? in the
Yeah.
lower part of their back.
Well, it's a funny thing. It's going to sound a lot like our other podcasts, but we're going to say either extreme. Life is kind of this beautiful bell curve. And if you're on that part of the bell curve where you
Mhm.
have enough movement to relaxation ratio, you're going to feel mostly fine. But if
Mhm.
you are overactive on this end of the extreme, you're going to run into problems. And if you're underactive on the other end of the extreme, you're going to run into problems. I
Mhm.
think for most people, we're going to boil it back to more of them are underactive. So I know we're guilty of it right now, but look at
Mhm.
us just sitting here, right? And
Mhm.
so sitting is probably by far the number one cause of us having low
Mhm.
back issues and lumbar erector tension.
Mhm.
And then you kind of mix that in with people not only just sitting, but then chairs that don't have good ergonomic support. They're sitting with kind of crummy posture like this while they're
Mhm.
on their phone and then bringing their neck down to further add tension to the low back.
Mhm.
But definitely by far the lack of movement, and that's sitting as well too. A lot of people don't really slow down to think about this enough, but even if you're sitting in a good erect posture and you've got, your ears over your shoulders and your shoulders over your hips,
Mhm.
and you keep the hips where they are and you come up from that position,
Mhm.
sitting is actually equivalent to being bent forward. And so
Mhm.
then that's keeping that tension load on the lumbar erector muscles. It's
Mhm.
keeping the compression onto the lumbar disc, and it's just
Mhm.
kind of setting up the mechanism of having low back pain. But
Mhm.
that's kind of on the underactivity part. Do you care to sort of take more on the other end of the extreme?
Mhm.
Like, what sort of patients or clients do you see
Mhm.
that come in and maybe have some low back issues due to
Mhm.
overactivity?
Yeah, well, it's kind of like the weekend warrior
Mm-hmm.
kind of a thing, or oh, I've just got to go shovel the snow, and then it's like suddenly you're adding a lot of load into that forward bend
Yes.
um, position as well. So then then your body has it does its best.
Yeah.
I guess, but there's a good chance that you're gonna tweak something, or because it's not you know properly, the muscle isn't properly stretched, and it's um, doesn't have the good circulation
Hmm.
um, in that area, and it's asking more of it than it's kind of used to,
Yeah.
I guess.
Yeah.
So.
I think the word that I'm plugging in my mind, and I didn't want to
Mhm.
interrupt at any point, but
Mhm.
deconditioned, right? So if it's
Mhm.
not either warmed up properly or it's just not used to taking that kind of load, you don't have the
Mhm.
proper conditioning in your
Mhm.
abdominals and your core, that the low
Mhm.
back ends up paying the price for it.
Mhm.
Yeah, definitely snow shoveling. For those of us that maybe heat with wood around here or coal, because I know that's
Mhm.
not an uncommon heating source in central
Mhm.
Pennsylvania. Picking up those loads or even the wood pellets, like
Mhm.
just a lot of lifting that we have to do in the winter season.
Mhm.
And then again, we kind of get into that point
Mhm.
of we're about to get into
Mhm.
4 straight months of cold where people aren't
Mhm.
going out and getting their walks and
Mhm.
keeping their low back limber and loose, and
Mhm.
a lot more kind of sitting on the couch eating popcorn and
Mhm.
having movie nights.
Yeah.
Not that I'm
And then
against that, but
yeah.
recognize that that's going to play into the lumbar erectors getting
Yep.
tense and some of the low back pain popping out, right?
Yeah. And then at the other extreme that you're
Yes.
alluding to,
Hmm.
something that I hear a lot is somebody who, for example, does a lot of deadlifting,
Absolutely.
and
Yep.
and they'll say something like, um, "Yeah, I used to lift a lot heavier, but now I'm
Hmm.
realizing that when I do that, it's causing this pain in my low back." So,
Yeah, right.
um,
Yep. So
mhm.
weightlifters with deadlifting and squats. I know we're
Mhm.
not really in baseball season, but it's going to be spring before you know it. So
Mhm.
too much of a repetitive swing one way.
Mhm.
Baseball players, golfers, once the weather
Mhm.
gets nice. Speaking of the weekend warrior,
Mhm.
once we get that first really nice day in March, a
Mhm.
bunch of people are going to go hit the golf course and we're going to get calls about sore backs because
Mhm.
they don't have that flexibility and strength in
Mhm.
their hips
Yep.
from kind of falling into passiveness in the winter months, right?
Mhm.
So
Yep.
plenty of causes of pain. I hope we
Mhm.
illustrated the point pretty well
Mhm.
for everybody listening to the
Mhm.
pod. How about you take this next one, Ben? So outside of the obvious
Mm-hmm.
low back pain being in
Mm-hmm.
the low back, where else do we frequently see pain with the low back problems or the lumbar erectors? Like, where do some
Mm-hmm.
of those trigger points like to go? Where do some of the nerve roots like to
Mm-hmm.
radiate pain?
Yeah, and in the glutes, for example,
Hmm.
especially the part of the glute that wraps around to the front of the leg. You see that. So, and then kind of where everything attaches. Um, yeah, I guess at like in the pelvis where you have that um, the iliac crest, you have those attachment points there. So it's kind of think of it as like if you're looking at the back and you think of kind of like a crest shape of the hip
Hmm. Yes.
bones like around there. So yeah, I mean, I guess kind of like lower down, and then if you have uh, uh, re- restrictions in the abdominals, something there could be pulling on the low back
Yeah.
as well. You could have, I mean, you're talking about some nerve impingement, I think.
Yeah.
So in um, in the sciatic nerve that
Yep.
can shoot
Hmm.
all the way up and all the way down.
Yeah.
So,
More frequently down
hmm
though, right? Yeah, we're thinking,
hmm
you're tracing out the pathway
hmm
perfectly, right? So if it's like the nerve that's pinched,
hmm
or chemically irritated, or just
hmm
space narrowing. Pinched
hmm
nerve is kind of like a blanket term that just
hmm
generally covers some sort of perturbation that lives on
hmm
the lumbar nerve roots that comprise and make
hmm
up the sciatic nerve.
hmm
But yeah, usually it's going to go into the butt. Then as
hmm
it gets worse, it's going to make its way down to the knee.
hmm
More frequently, it's going down the back of the leg, but it can
hmm
go down the side, occasionally down the front.
hmm
But usually, if pain is actually going more in the front of the hip, that's usually an indication that it's either like a higher lumbar segment or we
hmm
start thinking that it might be the hip.
hmm
And then things start to really be, dicey if we're getting pain in the calf and pain all the way down to the foot.
hmm
They can respond to what we do, but that's when we usually have to keep a little bit more in the back of our mind that it could be a trickier prognosis, and that
hmm
might be the patient that needs to
hmm
possibly have co-management of treatment,
hmm
i.e., like, okay, we're going to keep working with you with the exercises, the
hmm
muscle work, the adjustments, but you
hmm
might really need to have a good conversation with your doctor about seeing if they can get you like a steroid to calm down the inflammatory, like a muscle relaxer to
hmm
cut some of the extra tension.
Yeah.
So that way, the stuff we can do in here can actually get a
hmm
better foothold.
Yeah.
Um,
Yeah. And without
yeah,
those complementary therapies, meaning muscle relaxer, etc., it can make um, the body work in in talking more intense.
yeah,
I guess
most
without
definitely.
those, it's still definitely possible. It's just it's going to be a little more intense.
Yeah.
Getting alleviate some of
Hmm.
that congestion around the impingement,
Yeah. Yeah.
whatever it may be. So
Right. Right. But to go back to just the very basic though of where it's pretty straightforward. We're
hmm
probably looking at the box from basically the top of the butt here to
hmm
about the bottom of the ribs. And that's where Ben
hmm
and I are saying that's
yeah
probably going to be about 80% of a pain presentation in people, but it could
hmm
certainly travel up, predominantly down, but sometimes the
hmm
pain does travel up as well too. So
hmm
I so for common complaints, what are kind of like some of the things that should cue patients in their brain to say, I think I've got a problem in my low back, other than my pain is here, but what are maybe some of the activities that they'll start to pick up and register? Oh, I think this is like a lumbar erector, or just like a lumbar region issue in general.
um yeah, it could be like carrying around infants, toddlers, newborns, something like that. um Yep.
Yeah.
Any type of you know, like twisting motion, or something with work where you're doing like any type of like turning, where it's you know, things involving the hips,
Yeah.
things like that. So it can be many, many
Yeah.
activities that are,
Yeah.
um,
And I love, because this kind of goes
mhm,
back to the causes of pain. Ben just
mhm,
said the things that were on the overactivity, right? So a lot
mhm,
of repetitive bending, and then that starts to
mhm.
hurt after a while.
Yep.
Let's think about maybe like something that could also trip up the erectors would be like, say, the gymnast or the cheerleader that's doing a
Mhm,
lot of back handsprings and keeps loading up and over recruiting the
mhm,
muscles in that direction.
mhm,
Again, alluded to like the swinging
mhm,
sport athletes, our baseball,
mhm,
our hockey athletes.
mhm,
And golf when the weather gets
mhm,
nicer, not when it's snowing outside.
mhm.
But
Yep.
like those, but again, just like the common complaints that are going to exist in inactivities as
Mhm.
well too. So
Yep.
find a lot of times with the low back
Mhm,
tension. That those will be the people that will say, when I wake up first thing in the morning, my back is tight, and it takes
mhm,
like 30 to 60 minutes of just general movement
mhm.
to get the low back muscles to calm down.
Yep.
Also, again, sitting, like, hey, I used to be able to sit for 2 hours without my back like getting tight,
Mhm,
and now I sit, and after 30 minutes, it's starting to talk to me and let me know that there's a
mhm,
problem. And then I go to stand up, and I used to just be able to
mhm,
spring up with ease, and
mhm,
now it's like, oh, okay, give me a second here.
mhm. Yeah.
That's, if
Yeah.
you're getting that, that's a time to make
Yeah.
a referral to get
Mhm.
some massage work and get some
Yeah.
body work or chiropractic work and
Mhm.
get that issue back under control. So
Yeah. So like particularly occupation of office workers, and since it's getting towards the end of the year, we can pick on accountants a little bit as well, and
I guess we're getting into that territory. Yep.
tax preparers,
Yeah.
especially with the peak season, probably doing overtime sitting, and you know
No question about that.
yep.
So, good. I think that's pretty good for our
Mhm.
common complaints. I mean,
Mhm.
there's certainly more than that, but that's a
Mhm.
fairly comprehensive list.
Mhm.
On this part, this is kind of like a fascinating, just kind of tying the whole anatomical picture of people and actually
Mhm.
looking at people holistically. I know
Mhm.
we always break down our podcast where we go region by region, but that's just to dive deep in one area at a
Mhm.
time.
Yep.
But the reality is, we're all walking around as holistic people, functioning as
Mhm.
an entire, you know, everything synergistically working together.
Mhm.
So, usually I love listening to your presentations on anatomical and fascial trains.
Mhm.
So, what is kind of the tie in for the lumbar region when it comes to this, Ben?
Right. So for the lumbar region, there are, there's superficial layers, of course, and then layers that are deeper, below those superficial layers. So you have, like you have the erectors that travel, all the way up and down the spine and attach, you know, all
Hmm.
along the spine. So you can, imagine, think of it as one, as like as a network of highways, and then you have, it's imagine like you're trying to, get from all the way from, the pelvis all the way up to the neck or whatever, but then there's some construction going on,
Hmm.
right? Um so yeah, so every, we talk a lot about how everything is connected, there together. Particularly, um, one of the areas with low back pain um, that I definitely take a look at, if somebody comes in with that complaint, is going to be, the quadratus lumborum,
Hmm.
muscle, because it's one of those deeper muscles that attaches not only to kind of like towards the end of um, the spinous, processes, but then all it attaches to, the last rib, as
Yep.
well as the top of the iliac crest. So it's kind of like that, um, it's that deeper, um, structure that kind of glues everything, together there
Yeah.
as well. So
Well, and then by the sounds
mhm,
of it, you're talking about a muscle that again crosses multiple regions. So you're
mhm,
talking about something that's going
exactly.
to have some
Mhm,
influence on where your pelvis sits in
mhm,
space.
right.
And because it has attachment to that last rib, it's going
Mhm,
to change some of the positional of the thoracic region. So it's
mhm,
not just lumbar alone
mhm.
there, right?
Right, right.
Yeah.
So like you can imagine like if you're trying if there's tightness or any type of restriction in there and you're trying to you know do any type of like turning and that's all restricted, you can imagine the difference getting that worked out um, can make. So
Yeah, most definitely
hmm
can. So,
hmm
and then my little input as
hmm
far as holistic picture is I like emphasizing again, we've talked about in another podcast, lower cross syndrome. So,
hmm
again, there's going to be like this cross pattern of muscles that are overactive and over recruited and therefore likely to generate pain. And then usually the opposite side of the body, you're going to have that
hmm
weak, underutilized, and needs to be brought up in strength. So when
hmm
we're talking in the low back here, again, those lumbar erectors and that QL muscle usually
hmm
have to frequently pick up extra workload because a lot of people aren't strong enough in the abdominals.
hmm
And then it crisscrosses across the pelvis, and you usually will see the glutes be weak
hmm
and the hip flexors be over tight through the front.
hmm
So again, just as far as like, hey, all this stuff is going to tie down into other regions and whatnot. No question, if you're having problems in the lumbar erectors, you can almost put dollars to donuts that you're going to
hmm
see some insufficient function at the hips,
hmm
and certainly moving your way up the anatomical chain and start to
hmm
possibly see involvements in like the shoulder blade region as well too. So
hmm
now, as far as like your approach of treating, I
hmm
know when you do your massage, you're kind of doing the treatment and you're assessing as you're going.
hmm
So, could you kind of talk us through
hmm
that approach there then?
Yeah, so during the massage treatment,
Mm-hmm.
you're palpating, you're feeling for those those structures as you're going along to see kind of what the texture is of the muscle, and
Mm-hmm.
then
Mm-hmm.
is this and um, you can tell through that if it's due to an activity or if there's something that's stuck, like the muscle tissues aren't gliding back and forth um, very well, and then you can pick up on is this is this muscular or is there maybe something else going on in that area? So yeah, I mean there's depending depending on the presentation that will determine the techniques that are being used, whether if it's like cupping or something that if the deeper muscle layers need to be addressed or if it's something more superficial
Mm-hmm.
or or sometimes there's something going on in a different region, so sometimes it needs to be addressed, something further down or farther up the anatomical um, chain. So, um,
Yeah, and
yeah.
I like what you said about you could kind of pick up if something's else. So you probably can
hmm
sort of figure out a little bit. I mean, you're of course extremely good at palpating the quality of the muscle, but you
hmm
probably do at least enough where you get close enough on the muscles where you feel maybe how restricted the spine could be,
hmm
and that could
hmm
sort of tip you off to say, "Hey, I'm going to do a great job with massage,
hmm
but maybe we need to get to
hmm
somebody that can help the function at your joint." Because
hmm
I know that's what happens back in our office. Just kind of
hmm
reverse engineer that, where it's like, hey, we're working on these muscles,
hmm
and I'm working on the spine. But if I feel like, you know what, I can get some of this muscle tension melted down, but with the
hmm
time I'm allotted and the tools I have in here,
hmm
I'm not going to get it all the way. So you
hmm
need to go over and see Ben and let him stick the TNT into these trigger points and these tight muscles
hmm
and bust that up for you some too.
hmm
Um, Now, as far as our treatment approach, right, I like to do a lot of dynamic movement, lots
hmm
of orthopedic tests, range of motion, general movement.
Mhm.
apply the McKenzie exercise protocol first. So I'm starting with, hey, let's get you on exercises first, and then depending on what kind of
Mhm.
exercises you could tolerate, that's going to really guide us and paint the picture to what sort of things we can do on the table as far as stretch, decompress, and what sort of adjustments you could really tolerate in that.
Mhm.
So we're already kind of teasing a little bit with the final point. That's always why I kind of tee up the treatment philosophy, going right into
Mhm.
the how we treat, because then kind of just sort of say, here's philosophically how we're assessing, and then
Mhm.
here's some top techniques that we like to do. So
Mhm.
when it comes to lumbar erectors, certainly if you're seeing myself on the chiro side of the hallway here, you're
Mhm.
going to get rehab exercises. Specifically, we're going to start with the McKenzie method to see what's the best exercise for improving your pain, your function, your movement, and cutting down your muscle tension. And then one of my favorites, and we're going to demo this on a technique video, is I love using my elbows to do a long elongation of those muscles and just kind of also sweep through and break up the adhesions that live in
Mhm.
the myofascial layer.
Mhm.
And then that also kind of serves as a nice little stretch. My favorite tool for hitting the lumbar erectors, the QLs, though, flexion
Mhm.
distraction table. So using the table to drop down at the hips and pull open the
Mhm.
back and really just work on so much blood flow, neurological reset,
Mhm.
and muscle tension reduction into all those
Mhm.
muscles. And then, of course, as a chiropractor, I love to adjust. Not everybody's a good candidate to be adjusted, though. So that's kind of what I always say. If we have to pick something else, so be it. Whether that's the person's in too much pain, they're apprehensive about being adjusted, they've had bad responses in the past, and they say, hey, can we try something different? Uh, you and
Mhm.
I think, are both pretty good. I guess not that I'm trying to pat ourselves on the back too much, but
Mhm.
we're both pretty good about slowing down, listening to what the patient says they feel like they need,
Mhm.
and course correcting accordingly, right?
Mhm. Right.
So, what are some of your favorite techniques to get after, like the erectors and the QL and whatnot?
Yeah. So use some nice muscle stripping is one of the techniques. Um, in general, um, when I'm treating that area, I like to start out broadly and see how everything functions as a whole, like fascially in that region, um, to see where there might be restrictions, particularly in that superficial layer, and then from there um, you can go deeper and or more specific to work out each individual muscle in that region. And yeah, so yes, I mean the sometimes the slower the better,
Yeah,
right?
yeah.
Sometimes you'll need to stay in an area for a while to let it um, release.
Yeah, melt is
Um,
the word I was thinking
mhm.
of, but yeah.
Yeah, yeah. So once it um, yeah, so once it melts, then kind of retests. And when I say retest, that means I'm palpating. I'm not really typically asking the client to do
Right, right.
anything, but kind of then go back to the um, broader palpation tools to see what's
Yeah,
going on. So
yeah. And then in my experience too, I
mhm.
think you like also utilizing some dynamic movement too,
Mhm.
right? Like you like to try to use
Mhm.
the hips as levers to
Mhm.
create some better
Mhm.
stretch and better release
Mhm.
into the low back as well too,
Mhm.
correct?
Yeah, just use. I like to use what I have
Yep.
available to me. So I like using um, the client's body weight as pressure whenever I can, so that way I'm it's kind of their body's helping them as well
Yeah.
along the way. So but yeah, I mean there's yeah many different massage techniques that can be used for that for that region. And
Yeah.
um yeah.
And just a reminder
Mhm.
to all the people that have stumbled upon our channel and or already
Mhm.
subscribed, right? That the
Mhm.
technique videos are going to come. So
Mhm.
some of the stuff that Ben and I were just describing, I know it could be hard to
Mhm.
visualize because we're talking through it. You and I could see it
Mhm.
in our heads. I know not everybody else can, but definitely stay tuned for the videos.
Mhm.
Maybe hit a subscription so that way you can see when those videos drop.
Mhm.
But otherwise, I think we did a pretty good
Mhm.
job walking our way through the whole
Mhm.
lumbar erector series. That
Mhm.
was a pretty
Mhm.
30,000 foot view of everything
Mhm.
that we try to do from
Mhm.
presentation to
Mhm.
pain and
Mhm.
pain travels and who we
Mhm.
expect to see and
Yeah.
whatnot there. So,
Yeah. But then along with, how we fix it,
yep.
we both have lots of, approaches and tools,
Hmm.
and we have lots of options available for treating that area. So,
Very true. Yeah, we just
mhm.
highlighted a couple, but there's a lot
Mhm.
more in the toolbox than what we even just talked
Mhm.
about there.
Yeah.
So once again, I am Dr. Emery Pitcel. I am Doctor of Chiropractic and owner of Rothrock
Mhm.
Chiropractic and Rehabilitation. You can follow us on Facebook at that name, and we're on Instagram, Rothrock Chiro, at Rothrock Chiro. And how about yourself,
Yep,
Ben?
and I'm Ben Ciccarone with Wellness Wave Massage. At wellnesswaymassage.com is the landing page for all of the social media things and more information about the practice. And you can also book right from our website as well. So it's very, very convenient and accessible. So yeah.
And we have that same thing too. Very easy to
Hmm.
schedule online.
Hmm.
I think that's
Yeah.
about 2/3 of the people that schedule with us
Hmm.
get so online and schedule their first one
Hmm.
online because
Hmm.
who really wants to be spending time on the phone when we all know you're out there getting your last second Christmas shopping done and
Hmm.
getting your last second
Hmm.
plans in place for the holidays. So instead of
Hmm.
worrying about spending 5 minutes on the phone with us, go ahead and just
Hmm.
schedule yourself online. But
Hmm.
we hope that
Yep.
everybody is happy, healthy, and safe this
Hmm.
holiday season. Enjoy the time with family. That's the most important thing by far is to spend the holidays with those that you love the most, right, Ben?
Hmm. That's right.
That's why I
Hmm.
enjoy doing this podcast with you in the
Hmm.
month of December because I like learning more from you, and
Hmm.
I hope the
Hmm.
feeling is mutual, and
Yeah.
hopefully just by us sitting here and kind of talking
Hmm.
about the knowledge we have, it
Hmm.
brushes off a little bit, and you all are a little
Hmm.
more better and empowered for it
Hmm.
from the B school, right?
Yeah. Yeah. Just, it kind of brings everything together instead of kind of being out in our own little bubbles. So it's
You got that.
very, very, very nice. So
For sure.
yeah.
So, well,
Hmm.
we'll take care until
Hmm.
next time. The next time we'll talk to you guys via podcast, it will be 2025 of January. So,
Hmm.
happy holidays, everybody, and a happy new
Hmm.
year.
Yep. Happy New Year, everybody.